Welcome to one more edition of Politics Done Right. I am here with a very important person because she has a story to tell. Mythili Ramakrishna Bhat. Dr. Mythili Ramakrishna Bhat. Welcome to Politics Done Right.
Thank you so much.
How are you doing today?
I'm doing fantastic. So glad to be here.
Listen, we wanted to have you so badly because let me tell you, young people now, okay, are the essence of what's going to change this country.
Absolutely.
Because as we know right now, the things that are happening in this country, the people that are holding us back are folks, they're not bad people.
No.
They just can't let go, and they just can't let go from what an indoctrinative force has done to them. So, first of all, Mythili, tell me a little bit about yourself.
Okay, so I was born in India, raised in India, did my dental school, then went to Britain to do my master's in public health at a very prestigious London School of Hygiene and Tropical Medicine. Very important school, and I'll tell you a bit about it later. It was an honor to go there, do public health, and I did a lot of research in HIV/AIDS, worked for WHO for a while, worked for LSHTM in London for a while, and then I was chosen to come to America as a Heinz Research Foundation Fellow. Now, that's an important thing too, you know. Heinz Foundation has been there for, years, and they choose two people from developing countries to come here and probably learn something from America and probably go back home and inculcate American values into India.
Okay.
So I think that was a modern way of imperialistic.
It's a new form of imperialism.
Yes.
It's what I call a
Absolutely.
technical form of imperialism.
Yes, absolutely. Anyways, little did I know that, and I came to Pittsburgh. Interesting institution there as well, and I can tell you why. Did research with Janssen & Janssen, Gates Foundation.
Oh, you did with Gates too?
Absolutely,
I am
I did.
concerned about you.
I know, right? I shouldn't be here on your show. I'm a traitor, right? Or rather, I should say,
No, you're not a traitor.
I probably saw all of that, right?
But you know what? The thing about it is it proves that indoctrination does not work with everybody.
No, it probably doesn't. Not
Not for you, absolutely.
Not for me. So yeah, I did that for 4 years. Then aptly, I did a master's in public administration in Cleveland, and also worked for a midtown city-funded firm. And then I decided to go back to clinicals. So for that, I had to go back to school in America.
Did you come in? Was that here in the States or England?
In States,
Okay,
basically. So
right.
no matter where you are, where you've graduated dental school, whether it is in Britain or Australia, in America you have to do 2 years of schooling again.
Okay, got it.
So that's what I'm doing, and I'm finishing in May at the very prestigious University of Michigan, and I say it very sarcastically for a reason. Probably shouldn't be advertising this, but no.
It is fine. It is fine.
So yeah, that's what I'm doing now. So I kind of come from a perspective of policy, perspective of actually working with a private organization
Right.
and a non-profit organization like Gates Foundation, and I have so many stories to dish out. Right?
Well, what is interesting is one of the reasons I like talking to you, right, is a lot of people think that our millennials are not quite apt to what's happening in society today. And what I find in speaking to people like yourself and Anand and all other folk is that you're well aware of what's going on. And the thing about it is the difference between your generation and a lot of the older generations is that you actually understand the con.
Yes. Yes, to a large extent, my generation is a lot more idealistic.
Right.
Than, pardon me if I say your generation.
Right.
And I think your generation also had the benefit of being mentored by the greatest generation.
Right.
And, I've lived in 3 different continents, 3 different countries, studied, worked in 3 different continents. And I can tell you that I've always found the difficulty in baby boomer generation accepting a different voice in any area for that matter. But whereas I found the greatest generation almost like pushing me to, you're excluded. You're almost like our generation, right?
Thank you.
But like the greatest generation has always pushed me to have a voice. In fact,
Right.
all my mentors are amazing people who have probably contributed so much in this world. Are all from the greatest generation.
Right.
One of my mentors is a Nobel awardee,
Right.
at the London School of Hygiene and Tropical Medicine, and you talk to him, he talks about inequality every day of his life.
And he understands the
And
implications.
exactly. And
Yes.
so here he is telling all of us, yes, you guys are all right, but then we have our parents' generation saying we're spoiled
Right.
and whatnot, which is kind of ludicrous and absurd.
Well, I speak a whole lot about that, when I talk about just something like the minimum wage. They're like, well, we used to do it on a minimum wage. And I'm like, yeah, but if you're doing it on a minimum wage 20 years ago at 7.25 and it's still 7.25, that means you did it on a lot more money than they're doing it right now.
Right. And I was, by the way, I waitressed my way through college. So
right.
I completely understand. And
Exactly.
What is minimum wage? What is under the table minimum wage? Working at an Indian restaurant where they probably were evading taxes. But poor student me, I had to pay my bills because I rebelled against my father. And I said, well, as a woman, I have a right to say something and I have a right to education.
Right.
It's interesting. India has passed a law right to education right now. And
Right.
a lot of wealthy right-wingers are probably against it, which means they have to mix with the
other not so what do you call it
the lower
caste right
people
right
there. So
right.
and interestingly, I was born in upper class, and I always come back to where I was born because it astonishes me that me being born in probably an upper middle class, an only child, to a businessman conservative to the hilt, like current BJP right-wing government. He was the state treasurer of that government. I'm not dissing my dad.
The heart of conservatism.
Heart of conservatism,
Yes.
right? And being born there, that I've had to fight the battles that I did, and imagine people who haven't even seen the other side of the coin.
Exactly.
And so I have a problem with feminism in this country. And why? Because I'm a feminist. I mean, have you seen me? Have you seen what I've done? Yes, I am a feminist. But I have a problem with saying, with the direction, I'm probably the second wave of feminist kind of a person and not the third wave,
right.
which is Wall Street feminism. I mean, these are women who probably have paid nannies, but like not fighting for paid maternity leave.
And that isn't feminism.
That isn't. But
that is a woman trying to be what men used to be.
Right, exactly.
It's a difference.
No,
yeah.
it is completely. And I get flack on internet. I have a white woman telling me that I am the reason why women's rights are backwards. And I'm astonished, and I want to say, have you even heard of my story? I mean, I'm a woman of color, as an immigrant, living in this country.
Right.
And I have fought my way up. And you, as a white person, are telling me that I am somehow pushing the feminist movement backward.
Right.
Just because I believe in a picture my husband posted, which was a proud Hispanic woman with a gun and a babe in her arms on her breast, which I thought was the most powerful image. I don't believe in whinging. I don't believe in whining. I believe that feminism is where policies need to change, and that is paid maternity leave.
Right.
I mean, it's absurd.
Right.
Anyways, before I digress, because I have the issue with digressing, and I see my husband rolling his eyes right there. I'll start off by saying a very simple incident that happened to me, perhaps. So I wear contact lenses and I have issues with my eyes all the time. My power is very high, and I was living in London, and one night my corneal, I think there was some issue with cornea. I just woke my friend up, and all we had to do was not even call. Like, we just walked over to the ER, which is Moorfields Eye Hospital, one of the world's best eye hospitals. Waited for about 20 minutes, saw an amazing doctor who gave me some eye drops and gave me some prescription,
and sent you by your way.
And sent me by my way.
And that was in the UK?
In the UK,
guess what? On what kind of medicine was that again?
What kind of a medicine was it? Like,
no. Like, what kind of a healthcare system was
National Healthcare System.
Thank you. NHS. It's called the NHS, people.
It's called NHS.
Right.
And so I went, got my prescription for about £3 because it's just very cheap there. Came home, got well. I was on my way, and I have this tendency of flaring up. My eyes flaring up, and this happened many times. And guess what? I came to Pittsburgh. My American city.
Good luck.
And I'm an employee of University of Pittsburgh Medical Center, right? The interesting part of Pittsburgh is all of them are owned by UPMC, and I'll get to you about UPMC. UPMC is a very interesting story.
Right.
And when I say British way of interesting, crappy. So sorry. I woke up a friend. He drove me at 4 a.m. because I had similar issues. Waited for triaging for nearly 40 minutes, as opposed to 20 minutes, guys. And then I was seen by an intern who was an ophthalmology intern. Wouldn't even ask me how I felt. That was not the first question. I was surprised. I said,
I
do
wonder
you
what
want to
was the
understand?
first question.
Yeah, how do you feel? How's the pain?
Yeah.
Well, none of them was that. So, well, these are the, drops and blah, blah, blah. Oh, you'll get your bill in your mail, blah, blah, blah. And I was sent, home. Oh, no, I had to go buy my prescription drugs, which I paid a lot of money, about $20 or something, as opposed to £3.
£3, yeah.
Went home, and then in a week I got a bill. And I really want you to guess how much that was. This was literally not even a corneal abrasion.
Okay, but you went to the emergency room.
I went to the emergency room. I was seen 40 minutes later by an intern
Right.
who just gave me an eye drop. This was
Right.
not even a
It was
corneal
over
abrasion.
$500.
That's it? Poor guess. $3,000.
Oh my God. I have a story like that, but this is your show right now, but I don't want to tell my story because I've told my audience many times before.
Yeah.
But I mean, I don't, let me tell you why I said $500. Because you said you worked at the hospital, I figured you got some sort of a break.
$3,000. But of course, like UPMC has my insurance and I have a copay and everything. But for what? I didn't even have a corneal abrasion.
That is because that is the money going to a few shareholders and all these other folk.
Right. And I was mad as hell. I was like, I called up my husband who's an American, and I was like, what on earth is this? And then, this is when I was getting to know America. Because you have a perception before you come to America. This is a developed
I want to
world.
stop you right there because I'm originally from Panama and Central
Right.
America, and all of us from the third world,
Right.
we have a perception of what it is
Right.
that America represents, and
Of
we
course.
always get a rude awakening when we get here.
Absolutely.
Tell us that
Well, it's
story.
a developing country now. It's not
Yes.
third world, but I do hear that term all the time.
Well, that's what I mean, you know that, but
Oh yeah.
you know that,
Oh yeah.
but
yeah,
others
yeah,
don't.
Yeah. So from that to sort of looking, I mean, where do I start? Okay. Yeah, I'll start with this story. At the University of Pittsburgh, I was interacting with the students there and things like that. And one of the policy classes, they were having these debates. Apparently, the tomato sauce lobby was lobbying for pizza to become a vegetable. This
Right.
was the first piece of news
That you got here.
that I got here, and I am concerned. I'm like, wait, what? Pizza is a vegetable? I don't understand this at all. I don't know the
Right.
Constitution.
The lobbying
of this
groups,
country.
yes.
Yeah, I don't. This is sort of a thing that doesn't happen in the so-called third world country like India, even. And then I asked the professor, who is, by the way, my mentor and an amazing professor, and he looks at me and he's like, "Oh, welcome to America. This is about lobbying because people felt like everybody's voice needs to be heard." And I said, "Well, then, what about the voice that says this is idiotic?" And he literally laughed and was like, okay, that's a reaction everybody gives when
Right.
when they come to America. But I'll give you another example. I went to shopping for my groceries. Now in Britain, there's everywhere you say 5 a day, 5 veggies a day. It's advertised everywhere.
Yeah, another good eating, yeah.
Right. And you in Tesco or anywhere else like Waitrose, you have to find the confectionery. Like you have to look for it.
Right.
Where is it? But what's the first aisle when you go to any grocery store you see?
Soda pop or something
Confectionery.
sweet. Yeah.
Confectionery.
Yes.
So do you see that vicious cycle of what is happening?
Yes.
I mean, it is more than rude awakening. It is, oh my gosh, did I pass through a looking glass?
Well, I want to stop you there for a second, and you do know this, but our audience have to realize that when folks come from abroad and see things like this, what they start to realize, what we know immediately is we've all been commoditized, and everything is made towards making a profit for something.
Someone, yeah.
And that involves, it's not, it involves turning everything into a product, even healthcare into a product.
Yeah, no, it's almost like, so the first time when I went to my physician at the University of Pittsburgh, the person was just typing away, not even looking at me. There's a traditional patient-doctor relationship that didn't even happen. The whole time he was in front of his computer. I was concerned by all of these. I kept observing all of these things, and I was like, I want to get bottom of this. And then, my husband, who was then my friend, is also a physician. We compared notes on teaching, by the way. I'm not going to sound rude to him, but I was way better trained, even though I was a dentist and I'm not an internal medicine physician.
Anand?
And I will tell you this because we started comparing notes. I said, okay, do you percuss? Do you palpate for these things? And he said, we were taught. I said, how many times have you drawn blood? How many times have you done IV? Me as a dental student, I was trained to do all of these things. And he said, not much, because we rely on diagnostics. Like we need CT scans, we need MRIs.
Or you get the flubbishes to come in and do your blood or your...
Yeah, because, you're almost like a product on a conveyor belt before someone comes and sees you, like the real doctor comes in. I have no disrespect for the phlebotomist. I have no disrespect for the nurse practitioners. In fact, nurses are fantastic. They're great resources. I learn from them and they care about you. But I have a problem when lazy doctors don't want to do their jobs or learn things to do.
Right.
And it's not really their fault. I started finding out
Well, what we have, if you notice, I've learned over the years now as I've interacted with people, is not to blame people for how we are, but the system.
It is a system.
There is a master on the system, and the system is creating this. And once we can get there, I think that is how we're going to be able to relate to people. So when you're relating your story in doing that, that's how we get to people.
Right. And to be thought of me as a product on a conveyor belt that each person is going to come and then, this person is going to come and this person is not even going to use his brain to diagnose a disease, but he's going to use a CT scan, which may not even be necessary. It is an unnecessary cost, but guess who's making that money when they're ordering a CT scan?
That's a whole issue behind it.
No, as a dental student this year, I was selected to be an oral surgery selective, and my chosen field is surgery, oral surgery. I want to get into oral surgery, and I love it. So I am being trained by a Chilean oral surgeon, which is an interesting...
Where was she trained? Was she trained
in Chile?
Okay.
And he and I compare notes, and he and I are shocked most of the times when we look at our patients who are coming with lesions on their tongue, which means they probably have cancers. But we have to look at the insurance, whether the insurance can cover this biopsy, this extraction, this procedure that this patient needs right now, instead of saving a tooth, for instance. When I'm pretty sure all of you will have gone through dental procedures.
Oh, yes.
You have pain. And, you know that dental disease is progressive. It'll never stop, which means you probably need a filling. But you'll not come fearing the dentists are all privatized and cash. You probably don't have cash, so you won't come to me. And then it'll keep progressing to an extent it'll reach your nerve, which means right now I have to do a root canal treatment on you. But guess what? None of the insurance covers root canal.
So it's out of your pocket, so you let it fly.
Or no, get it extracted, even better.
Right.
I'll extract your tooth. Why don't I extract all your teeth and give you a complete denture? Because your insurance covers that. Your insurance doesn't cover, and it's not bothered, saving your tooth.
Right. They just want that. And it's a shame. And, here's an interesting thing from what you're just saying. Insurance would want you to do that, right? But at the same time, we have the lobbyists in America saying things like socialized medicine or single payer or whatever. They are going to tell you what to do, when the reality right now is we have insurance companies whose sole purpose is making a profit, saying we don't want to pay for that, and because we own you as a person of the policy, you don't.
No, and I get frustrated when I see these debates, and then you have Pete Buttigieg, sorry, I'm not a big fan, keeps saying, oh, we don't have a choice if we have Medicare for all. I'm thinking, I'm in Britain. There's Medicare for all means I can go to any hospital wherever I want. I can get the best of the best.
Mythili, let me tell you, and we are at a very serious point here.
Yeah.
That is a message that needs to get out, because what happens is it the same way it drives you crazy when you hear Medicare for all means I don't have a choice. No, private healthcare means you don't have a choice. And to put it bluntly, I'm upset at Bernie and I'm upset at Warren for both not... Look, the narrative should be private health care tells you what to do, my health care don't.
Right. Okay. So I'll give you an example recently. It's actually a very personal example. I didn't want, I think the reason I didn't want to say it is the personal issue that it is. And it's right now, it's happening in our family. My mother-in-law needed a breast biopsy. Now, my father-in-law is a physician. She's physician's wife. That means she can afford, right? She's an affordable care, Obamacare, basically for small businesses.
Because they're a small business,
Small
yes.
business, yeah, right. So they had a mammogram, they found spots, and she needed a biopsy. Guess what happened when she approached a place to get her biopsy? How much did they quote? Do you think first of all, do you think the insurance covered it?
They should.
Well, no, they didn't.
But wait, if she have a Obamacare, first of all, she should have every year a checkup that they cover they cover the mammogram.
They do.
But if
Partly.
she has to go for a biopsy, she has to pay for the biopsy.
Yes, she has to pay for the biopsy.
Right.
And her premium every month, by the way, under Obamacare is about $500 to $800 that she's
Right.
been paying every month.
Ridiculous, yeah.
Ridiculous, right? Anyway, this is affordable care. So she goes, guess how much they quote her for the biopsy?
I'm scared to even fiddle with
This
that.
is a doctor's wife. And and you've met my father.
Yes, I have.
Who actually is against Medicare for all,
Yes.
by the way, FYI.
It's still?
Well, I don't know.
Okay. Tell me what they quoted.
$12,000.
Whoa. Hold on. For the listeners out there, listen to what Mythili just said. A doctor's wife had a spot on her breast, and they decided to do a biopsy, and they quoted her.
$12,000.
Okay, hold on a second. Is that $12,000 that she would have to pay
Yes, out of pocket.
for the particular insurance policy she had with Obamacare?
Yes. And many of the places that she wanted to go was not even in network. Then she asked for cash price. She said, you know what? This is ridiculous. Give me a cash price. They still came up to about $6,000 to $8,000. It was a hell nightmare. She, in fact, even said, should I even just wait? Should I even go gone?
No.
I mean, yes, of course she knows that as a doctor's wife.
yeah.
But like I'm saying, what? And she asked me this poignant question 2 days ago. And she is not particularly fond of Medicare for all, by the way. I'm just giving,
Right,
all
right.
of this. And she asked me this poignant question. I, as a doctor's wife, we can afford,
To pay that, yeah. But you don't want to. Yeah.
You don't want to pay that, but like I'm imagining, what about poor people? Like she was on phone. Oh, I have to tell you this. She was on phone to say, why am I out of network on all of these phones? And it went to Philippines. And so she's frustrated here. She has a lesion. She is probably needs to be emotionally like, oh my gosh, am I gonna have breast cancer? She, instead of just taking care of herself, she's on phone every day trying to figure out why it's 12,000 and why certain hospitals and diagnostic centers are not in her healthcare network or whatever. I'm sorry, and it's a phone tree, and it's going to Philippines, who does not understand her. And in Philippines, he's like, oh, where's your address? And when she says, I need it for biopsy, and she's like, Bopsy? Bonesi? No, I'm not blaming the Philippines.
Right, no, I know. It's because, again, it's not their language.
Yes. And someone who needs this is doing this.
Yes.
And she at least has support system. So think about people who don't have any of this.
And, that's known as empathy. What we have to instill in the average person listening to this right now is a feeling of empathy, even if they can afford it. That what about those who can't, which in this country right now equates to about 80% of people who can't handle a $400 bill.
Yeah. It is rather frustrating.
Now, how did she resolve the $12,000?
She paid cash.
$6,000.
Well, no, she went to Beaumont, and my father-in-law called up someone he knew, but she still paid about $2,000 in cash to get a biopsy.
And think about it. That's because she knew somebody, another doctor,
who was doing it as a favor
for your father for $2,000.
$2,000, by the way.
Out of pocket.
Out of
Folks, anybody who thinks that Medicare for all, for those who want it, really means for those who want it, they're fooling themselves. Continue, Mythili, because that is, Mythili, that is...
No, it is sad, isn't it? I mean, and here is a person who's never been Medicare for all actually asking me these questions. And we talk about it now. It's a subject. When it comes to us, what we need to realize is, Hey, I'll tell you something. My husband is a physician, I'm a dentist. I can make a million, but I'm not fighting for that crap. Sorry
Right.
to say.
Right.
This is the only country where I meet medical students, dental students, and I ask them, why are you doing medicine? Why are you doing dentistry? And the answer is, oh, for a better lifestyle. It is never to save the world. Yeah, it's naive. But hey, you know what? You go to Britain, you go to India,
And
they'll
those-
probably say there's some altruism to it. And this is why I wanted to say London School of Hygiene and Tropical Medicine is an important school because I was the youngest in that class. It was difficult to get in because all of these are doctors from every country in Africa, every country in Asia probably, and they're all 40, 50-year-olds who are country heads of WHO who've dedicated their entire lives in Africa coming studying public health to go back and do something good. They're not fighting from I'm going to get 200,000, 300,000. I want a comfortable life. They're not doing that. I wasn't in a company like that, and I came to America. I was disappointed.
You know, Mythili, I'm glad, and I keep talking about the young people that I've been around, and I have a daughter in med school right now, and my
Right.
daughter says the same thing now. My daughter says she is not in it
For
for
the
the money. She actually, and the stories that she tells me, she's in clinicals right now, our third year, and the stories that gives her the most pleasure, she put on her Instagram, I helped somebody today.
Right.
I
And the
actually
feeling.
solved her problem today.
Right.
And I showed a few friends the message saying, "This is my daughter.
Right.
This is
And you're
my
proud,
daughter."
right?
And
Yeah.
I am not proud that she wants to be this highfalutin doctor.
Right.
I'm proud that she's at this hospital saying, "I helped somebody."
Exactly. Alleviating pain.
Right.
Looking after them. So I did a master's in public administration, I told you. One of my thesis was a center point of my experience that in Pittsburgh, why was a doctor typing away, not looking at me and empathizing with me, touching me, feeling me in the sense like percussing, palpating, and why is he just saying, oh, this is out a CT scan, like a lazy person? The more I did my thesis and I researched, I came up with this. So I did hermeneutics and I took philosophical, studies into it, like Gadamer and stuff like that. And I realized one thing: what was going on is like a circle. Because you have these insurance companies, you have these medical, whatever, painkiller, for instance, right? I didn't even know in America, by the way, this is only in America, the fifth cardinal sign is pain.
Yes.
Yeah, and that is how they used to get opioid. That is how they
Yes,
used to
yes.
make opioid crisis. By
Yes,
the way, before it was
yes.
even opioid crisis, and it was all there, and I was like, huh? Wait, pain is the fifth cardinal sign. Okay, that itself is amazingly
Right.
stupid. But when you put in all of that in perspective, as a university, why should I teach you how to touch, feel? Why should I hear,
was-
auscultate? Why should I even, waste it? So I come back to what I said with my husband, who said, I only learned it 1 year, but I never got to practice it. Whereas in India and Britain, we don't. We use our brains that we went
Right.
for 4 years for med school or dental school, diagnose, look at a patient, ask his history, take the time to talk to him, and don't the amount of misdiagnosis in America is very high.
It's huge. And, again, because, they don't.
No, they
have the
rely on they rely on
diagnostic-
CT scans.
Right.
And there is this thing in the hospitals, the more CT scans you are, it's better for them, better profit, blah blah blah. So you're not utilizing my brain to ask you, okay, tell me your history
The
of
history
pain.
says so much.
So much more,
Yes.
right? I was trained in a conservative, in a very old, now they call it old-fashioned way. I don't think it should be called old-fashioned way, but it
Right
should be
fashion.
right fashion. So there is that doctor-patient relationship. This is my thesis where I said, now think back to why there's so many misdiagnoses by students. Don't blame the students. Don't blame the university even.
Right.
There was a time when my husband said, I'm a highly paid professional scribe. I didn't take it seriously, that sentence, but as I was doing my thesis,
It
I was like,
speaks volumes.
right?
Yeah, that's...
I mean, like all he's doing is paperwork. I realized that when I started dental school and I started seeing patients and I'm doing oral surgery with the oral surgeon who cares about the patient, who cares about the surgery. Instead, he's like, I need help with paperwork. Why on earth am I doing paperwork?
And they don't understand that is also that cost, an unnecessary cost, all that paperwork.
And it
unnecessary
actually,
cost.
it actually discourages some clinicians. Like, say, for example, I have this patient for a biopsy, very important, on tongue. And we had to do a ton of paperwork to sort of even prove that, hey, he needs a biopsy. He probably has oral cancer, dude, But you had to do a ton of paperwork. At one point, one of those clinicians was like, I'm tired. Maybe maybe just ask him to pay out of pocket. I'm just tired of doing this paperwork.
Wow. Yeah.
But can you blame the clinician? Who are you going to blame then?
No, you can't. Mythili, I tell you, one of the reasons I wanted to have you here is people need to hear this realistically, not only from a doctor's point of view, but somebody who's been a patient as well. You told me you brought a book.
Yes, I bought a very important book. It's called Teeth.
Tell us the story.
It's by Mary Otto. I met her at my dental school. She's a prolific journalist. This is about DeMonte Driver, I forget, 5-year-old, 6-year-old African American, of course, in Maryland, who died because of an abscessed tooth, because there was lack of emergency care. He went to emergency care, he declined, and this is what happens to many dental pain, right? They have an abscessed tooth, it swells up. What people don't understand is an abscessed tooth, and how directly the spatial infection is to the blood, and how it can cause septicemia and die. You can probably just die if you're not treated well. And this is what happens in a system that in an emergency where there are no trained dentists. And by the way, that is something we are pushing in American Dental Student Association.
Right.
We are pushing for dentists on call in emergency so that they can diagnose your
That
dental
as well.
pain.
If you have an abscess or something.
Yeah, I mean, it's not like a medical doctor can, diagnose these things. And, if you have a really bad infection, you have to do I&D right there.
Right.
And they're not equipped to do it. All they give you is an antibiotic and tell you to go home. And his story, and anybody can Google this and follow this story. It tells you how that system is created, that even just for an abscessed tooth with no emergency open, with these so-called non-profit hospitals, which I will tell you a little bit because I have history with that too. And he goes from one hospital emergency to another hospital emergency, could not go to a dentist because everything is cash-based, whatnot. And within like 3 or 4 days, his abscess has become septic, Ludwig's angina problem, where both of your spaces are infected, and these spaces are very important, and goes to the danger spaces, what we call in your mediastinum. And he unfortunately basically dies. But what is important is many dental schools, we don't talk about this. I jokingly said I went to a prestigious University of Michigan, but I have to tell you, I have met the most amazing professors. Some of my fellow students do care about this, and in any system, even if you're in Harvard, you probably hate the system, but you probably like some people in Harvard, right?
Right.
It's the same thing with the university that I go to, and that's why we had Mary Otto sitting in front of me, and I'm asking her these questions, and she wrote this amazing book where she's talking about inequality and struggle of oral health care in America. And nobody talks about this because first of all, you're not even here to talk. I mean, you're not even at the Medicare for All to talk about.
But
dentistry.
Also, it's not something that talking about it is going to bring more income. No. Because already we know that it's all, so it's not going to bring any more.
So I highly recommend all your readers to actually read this book, and I'm going to be writing a review of this book soon. And
send it to me when you write it.
Yes. It asks important questions about oral health itself. It's not, dentistry in this country is perceived to be just like smiley, sparkly teeth.
It's actually a health issue.
It is a health issue.
Yeah,
and systemic conditions exist in oral, and this is why I did public health, because I saw so many HIV/AIDS patient. One of the first manifestation of AIDS is in the mouth. It's called oral candidiasis, and I was able to follow these patients up who have never had AIDS testing or HIV testing, where they would go late because I said, hey, you have oral candidiasis, and probably you should go get checked, and they would come back and say, yes, we're HIV positive, and then you can actually take it early while before your immune system is completely destroyed. And AIDS is such a disease. It brings it's controllable now. In America. Let me hear. Or probably in parts of America, that's it. I could say like a black person living in a city would still probably never get an antiretroviral drug. The triple, Yes, the ART, and forget in India, there's no ART. So I worked in HIV within the LGBT community, mostly transgendered community, in India, in Britain, and in America. And I have to tell you this. I have to tell you this very interesting story. The grant, the HIV Gates Foundation grant. My professor was gay, and he's from Britain, and and he headed this project. And every time I would say, "Why is there no T in that? Why is there no transgender community in it?" And he would look at me and say, "Everything in America is political. I cannot even say transgendered community in a grant, NIH grant." Right. They would freak out. They would not give me funding. So at least let me fight for just the LGB part of it, And I was like, Oh, I thought America was amazing.
You know, I want to say something about the drug. I don't remember the name of the drug, but this was the combination drug that controls HIV was
Yeah.
developed publicly,
Yeah.
and it costs a fortune, 20 something thousand or more, no, $80,000
yeah.
a year
Yeah.
to give it. These are things that cost dollars to make that
Yeah.
should be able to be given to people all over the world.
Yes. Yeah, okay, so LSHM had this, so as much as it was prestigious, before students started protesting and doing that, they went to Africa to do their trials, drug trials.
course.
But of course, where do they give the drugs here with like 4 times the cost of
Right.
everything? And you're in India where they're, it's interesting. My mother-in-law would always ask me to bring back drugs like painkillers and antibiotics from India because it's like
A lot cheaper,
One-
pennies.
like probably $1, I would get 30 tablets.
There you go.
So
And over here, that's probably $50.
no, I mean
Yes.
it's capitalism 101 here.
Yeah.
And I'm not saying this, okay, my husband is a self-professed socialist. I don't know what I am. I'm still figuring it out. I don't care.
Well, I
of
mean,
any ism.
the truth of the matter, Mythili, is we don't even have to give labels, right?
Yeah, exactly. I
We
agree
don't
with
have
you.
to give labels if we're giving people what's going to make them better.
No, absolutely. So just yesterday we were meeting young doctors. There was a young Indian doctor, interventional radiologist, a friend of ours, and we were talking about it. He would ask me questions. He would be like, "Why Medicare for all?" He asked me a very important question. He said, "Okay, you're a brilliant doctor, and there's the bottom of your class doctor, right? And you both practice. Why should the public get him and not you? In your socialized situation, he may get him. He may never get me." And so I was like, okay, let's rewind it. Let's bring it back. If I was brilliant and if I was whatever, my motivation is money. So I probably would never even work in the public system.
There you
firstly.
go.
I would probably always work for
But the thing
private
about it
companies.
is, what these guys don't understand is you can say you're a brilliant doctor and there's somebody that is not as brilliant as you are. But the one thing you guys do is you follow procedures.
Exactly.
It's
There
a,
is a
it's a
standard procedure that you
design
still do.
procedures.
Exactly.
And now he has
Exactly.
a problem, he may come to you to help solve. You were in Brazil recently, right?
Yes, as a part of University of Michigan Global Health Initiative.
Now, tell us a little bit about Brazil, a country that's not considered first world. It's not third world, but it's a developing
Middle income country.
right. Now,
Yeah.
I understand they can afford to pay the college for their students, but you also tell me about their healthcare system.
Yeah, so I actually did not even go to the main, I went to some Baru,
Right.
which is like in the middle
Of the country, yeah.
and stuff like that, are very white, who all voted for Bolsonaro at that point. It was
Can
interesting.
you believe that?
So I can believe anything now.
Now, Bolsonaro, Trump, what can I say?
But here's the thing. These
Yes.
are doctors who still voted for Bolsonaro. But I have to tell you, have you heard of cleft lip and cleft palate?
Oh, yes.
So it's a huge big deal, right?
Yes.
And it's some, you do those surgeries, but for the rest of their life, they need to be followed up.
Right.
They have rehabilitation work. So there's a hospital called Centrino,
Right.
okay, that I frequented and I was part of, observing and, all of that
Right.
interesting stuff. But what I want to say is that I met a 90-year-old Japanese Brazilian person who came for his I think they had opened it. It's been like 30 years since
Right.
they opened it for his checkup that happens every 3 months from a very remote part of Brazil. They get patients from Amazon and they get patients from Central America.
Right,
By
right.
the way, and their trip from coming and getting those very important surgeries to the rehabilitation is all free of cost. Free of cost. This is
Brazil pays for it.
Brazil pays for this.
From the middle of the Amazon into town.
Yeah, and then they have something called teledentistry. We talk about telemedicine, teledentistry
right.
in this country. I actually saw it happen.
They are making it happen.
Yeah, so in these remote parts, they train their health workers to do the follow-up. Say, for example, you get a oral device and that needs to be tightened every month. They can't come all the way from
Right,
Amazon.
right.
They have a teleconference telling that health worker, following up. So they make once in a 6-month trip or once in 3 months.
Right.
From the time the mother is conceiving, pregnant, they do genetic studies all for free. This is cutting edge genetic studies that I saw in Brazil. I haven't seen something like this
In the States.
India, in Britain, or in
Or in the
America.
Amazing.
I mean, this is like multidisciplinary care, physicians, speech pathologists, pediatric surgery, people, oral surgeons. They're all coming together and making this happen.
So that all but below the exceptionalism of our healthcare system. That's so much
Exceptionalism
better.
for a lot of things, right?
Exactly.
I mean, like that's the whole point, right? It's interesting. In 1960s, Indian court said right to life must be interpreted as right to health. Okay, is there a right to health? Is there a right to life in your country?
I mean, we like to say that.
No, there is no constitutional.
Not in the Constitution is a property document.
Exactly, but
Yeah.
there is no amendment. There are no
Right.
amendments which say right to
Right.
constitutional.
Even the new South African Constitution.
So how
has
can
that.
you believe in a state? How can you pay taxes? I paid 40% taxes in Britain.
Mm-hmm.
Okay, I have to tell you this important thing that Bernie Sanders is the only candidate who's talking about raising taxes. But that 40% of taxes means I can go to the hospital for free. I don't have to think about who's going to pay for my breast biopsy, who's going to do
Exactly.
my pap smears for
Exactly,
free. You know, I
exactly.
cannot. I don't have to do that. Even though I
exactly.
paid 40% as a waitress, may I add,
Right.
as a college student, whatever it was, I paid because I did not have to pay for anything else.
And actually,
And how
it's
much am I paying now?
it's a
I'm
better
still
deal.
paying. Yeah, it's a better deal because I'm still paying taxes.
Right.
And I'm still paying premium and high deductibles. You know, these are terminologies that I never even understood.
And that is what we have to get.
I don't have a physician.
Mm-hmm.
I don't go, I'm a lazy person. I am a doctor, dentist, whatever. I don't go to see a physician because it's a tree of calls. And you know, people say, "Oh, you have to wait in Britain." And I say, "People, here, I have to wait for months for a gynecology appointment."
Right.
And I'm like, "I can't keep it. I have still not gone for my ophthalmology
Right,
appointment."
right.
So if I have a bad health-seeking behavior, do you honestly think, I mean, I'm a clinician, do you honestly think a non-clinician who's probably busy working
go.
4 jobs to make things happen will make that call and will pay to go see a physician every year? Because
No.
I have seen patients
No.
who come to a dentist when they're to take out the tooth.
No.
When I say that, there's a question, when was your last physician's visit? And like 80% of them say several years ago. So then I have to send them to a physician for getting their tooth pulled out because I don't know if they're hypertension, and they have like mad hypertension, diabetic, uncontrolled diabetes and hypertension. And I'm like, okay, I can't pull out your tooth.
Right.
How am I supposed to do this?
Right.
How am I supposed to do this job if I can't even, you know, this is what I'm saying. This is
It
Brazil.
makes
This is
no
Brazil that is doing it.
But look, we're getting close on time. So what I need to talk to you about is your politics now. Tell me what are your thoughts on the current political the modal that we're in right now?
I think there's a deliberate attempt from mainstream media to shut some candidates off.
And they are?
Tulsi Gabbard, Bernie Sanders, Elizabeth Warren, mainly. 3 of those candidates. I am still in support of Bernie Sanders. I know some of your listeners may like, some of your listeners may not like, but I can tell you this. I worked very hard in 2016. I was part of the campaign in Ohio. I saw one-on-one how dirty money politics was. We were in the DNC convention sitting next to a bundler. And I have to tell you, I've never heard that terminology, bundler, till we met him.
Exactly.
And I was like, so what do you do exactly? Oh, you bundle money.
So that
Oh
you can
my
get around the
gosh.
claims and the limits and all of that. Yeah.
Right, and I met Hillary Clinton at her campaign, by the way. And I'm not okay. So by the way, I'm not even from this country, right? I mean, like it's a freeload. You can people can come and
Right.
convince me
Who to support, yeah.
right? And so yeah, I did go, and I remember I think there was a huge protest from Black Lives Matter, and they shut it down when. What's the guy who ran her politics?
Oh, I know who you mean. Yeah, I don't remember.
Sorry, but
Yeah.
scumbag to the core
Yes, yeah.
was like, oh, let's increase the volume, and this is Black Lives Matter.
Yes, yeah.
You know,
Well,
yeah.
it happens at Netroots as well.
No, of course.
Yes.
You know, of course. But I have to tell you, I also worked in a inner city Cleveland, the famous Huffman Street, where the strikes happened.
Right.
Schools there, Martin Luther School,
Right.
government school. One summer when I was teaching those kids,
Right.
most brilliant kids I've ever heard. All the mainstream media does is talk about DC, talk about all of these things, and I'm saying, do you know that a kid came up to me and said, you know, hey, his first meal is probably Monday morning when we get the free
Right.
meal. Last meal was probably Friday, whatever.
Right.
And he probably is eating junk food somewhere
All the
here
way
and
around.
there. He comes and he says, oh, you know, Dr. B, my dad came in, he took a shot and like a
Right.
gunshot. And he passed out on our floor. He never woke up, And I'm like, this
No.
7 to 8 year old telling me this with nothing in the eye,
No emotion.
no emotion. And I'm thinking, am I living in Africa, Kenya, India? No. And even
My-
they're better, right? I mean,
Mythili, let me tell you, the Americans right now that are seeking centrism, that are looking for the middle ground, they just don't understand how badly this country has moved from the level. They don't understand how bad inequality is because our media have made those people
Exactly.
invisible.
These kids, how do you expect them to apply to college? I
Right.
brought Anand to talk about how to apply to college for a
Right.
16-year-old. They
Right.
don't know. They're
Right.
even looking at the application system saying, oh, I
Right.
need a recommendation letter.
Right.
What is a recommendation letter?
Right.
So if you're going to ask me that question, who do I support? I do support a candidate who has been consistent all his life. I do not care if he's 78. I do not care if he's 80. And that is Bernie Sanders for me. I'm left of Bernie on many issues, by the
Right.
way, and he's not a socialist. Whoever
Right.
thinks he's a socialist is ridiculous.
Ah, well,
Read
because
your-
he calls himself he just doesn't. I mean,
Democratic
he's a
socialist,
democratic
right?
socialist.
Right.
The thing, and the reason the reason I started to start talk about policy and not labels is because I've noticed when talking policy,
Yeah.
people listen to me and they
Yeah.
want it.
Yeah.
But
Yeah, yeah,
once the policy is tagged,
Yeah.
the carnal part of their carnality comes out, and that is
Yeah,
what
that's
we,
why I don't
yeah.
like giving myself whether I'm East or whatever,
And-
Marxist
and-
or
and-
whatever.
right,
I
and
do
the
not
thing
care.
about it is just say, this is what I want to do for you. But anyway, give me a closer. Give me a close, and I want to hear I'm making you the representative of millennials right now, and what you guys want to see.
I think we want to see a just, fair, and by that I mean equal opportunity for every.
Not equal access. I mean, not equal outcome, but equal access.
Equal access.
Right.
Exactly. That's important. Not legacy students being taken at universities. Not public universities made so inaccessible. Like, for example, there's no affirmative action at Michigan, and University of Michigan scored a C in diversity. No. So we want equal access. And more importantly, I think we should all start thinking, if my neighbor feels good, I should feel good, right? I mean, if you feel good, I will feel good. What happens to you matters to me. I have seen many Asians, Southeast Asians saying, oh, I don't care. African Americans, I don't care. But I'm like, their rights they're fighting for my rights.
Exactly.
Their rights are an important fight. A Muslim right is an important right. So I have Muslim friends right now living in, they're scared, but they shouldn't be.
I mean, look, humanity.
And you talk about freedom of speech in
Yes.
this country. There should be freedom of speech on the left. They say there's too much freedom of speech for the left and not for the right.
That's not true at
that
all.
is not true at all.
Yeah.
And then when they blame Tulsi Gabbard for talking to Donald Trump, I get
Right.
irritated.
Right.
And Pete Buttigieg even mentioned that in the last debate. Well, it's like, oh, yeah, like Donald Trump met whatever. See, I'm going to say this straight. Okay, Donald Trump got two things right when he did last time. Whether he fulfilled or not, we know he didn't. He said no more wars and take the trade policy out, which is absurd. That's why you don't have manufacturing in America.
Right.
And he got two things correctly, which Bernie did the same two things. Okay. So let's, they say that the broken clock is twice right in a day. So let's not completely say, oh, if I talk to a right winger or I have friends who are against abortion. I have friends pro-abortion, but I have friends. Get out of your silly bubble and talk to people as human beings, agree to disagree, and be sympathetic and what else? Be human, right?
Mythili Ramakrishna Bhat. Let me tell you, that is wonderful. That's a wonderful way to end it. Let's just be human.
Let's just be human.
There you go.
It was so good talking
Absolutely.
to you. Yeah.
Absolutely.
It's always a
Absolutely.
pleasure. Yeah. Thank you so much.
Absolutely.